Gluteal region of the thigh. I'm going to discuss about the gluteal region in detail. First, we'll learn what is the gluteal region and where it located. Actually, it located behind the pelvis and is bounded by the superiorly by the iliac crest and inferiorly by the gluteal fold. Now, this gluteal fold is not the inferior margin of the gluteus maximus muscle. Gluteus maximus actually go obliquely towards the lateral aspect. The lateral boundary of the gluteal region is if we draw a line adjoining the anterior superior iliac spine to the front of the greater trochanter. So this margin is the lateral margin. Medially, the gluteal region is marked by the natal cleft. So we'll go from superficial to the deep. First, we look at the superficial fascia of the gluteal region. Actually, the superficial fascia consists of fat, and because of this heavily laden fat, it gives a characteristic convex appearance. In this superficial fascia or the fat, it contains cutaneous nerves, vessels, and lymphatics. Blood supply to this region is by the superior and inferior gluteal arteries, and the lymphatic drainage into the lateral group of the superficial inguinal lymph nodes. So what are the cutaneous innervation? Actually, you can see the nerves supplied to the skin come from all the directions. For the easiness to remember, we can actually divide this region into 4 and we can remember the cutaneous innervation. We can learn as upper anterior quadrant, lower anterior quadrant, upper posterior quadrant, and lower posterior quadrant. The upper 3 lumbar nerves L1, L2, L3 slopes down over the iliac crest and supply the upper part of the gluteal region. Then the upper lateral part is supplied by the iliacohypogastric nerve and the subcostal nerve. Lower lateral part supplied by the lateral femoral cutaneous nerve. Then the central part, lower central part, this region is supplied by the perforating cutaneous nerve and the posterior cutaneous nerve. Towards the natal cleft, the skin is supplied by the upper 3 sacral nerves S1, S2, S3. And the skin around the coccyx is supplied by the lower 2 sacral nerves and the coccygeal nerve. There are several muscles located in this gluteal region. We'll discuss from superficial to deep. The most superficial one is gluteus maximus muscle. It is a bulky muscle. And then beneath that located gluteus medius, and beneath that gluteus minimus muscle. Deep to these 3 muscles, another set of muscles located. We learn them gradually. First one is piriformis muscle. Then we have the obturator internus muscle. Between the piriformis and obturator internus, we have the superior gemellus. And below the obturator internus, inferior gemellus. And below the inferior gemellus, quadratus femoris muscle located. These are the muscles in the gluteal region. The bones included into this region are hip bone, sacrum, and the upper end of the femur. Main ligaments included into this region is the sacrotuberous ligament and the sacrospinous ligament. We'll learn about the gluteus maximus muscle. This is the largest muscle in the gluteal region and the most superficial one, and it originates from several places. In the gluteal surface of the hip bone, we can identify 3 gluteal lines. Inferiorly, there's the inferior gluteal, and between the origin of the gluteus medius and minimus, there is the anterior gluteal line, and behind the origin of the gluteus medius is the posterior gluteal line. The gluteus maximus muscle origin gluteal surface behind the posterior gluteal line and also from lumbar fascia, and the lateral mass of the sacrum below the auricular surface and from the sacrotuberous ligament and also from the coccyx. In the anterior border of this muscle, the iliotibial tract splits to enclose the muscle, and the layer beneath the muscle is the thickest. Gluteus maximus muscle actually inserts into 2 places. The deeper fibers in the inferior aspects inserts into the gluteal tuberosity of the femur. Then all other fibers inserts into the iliotibial tract. So there are three bursas located beneath the muscle. One is over the ischial tuberosity, one is over the greater trochanter, and one is over the vastus lateralis. Superior and inferior gluteal arteries supply the gluteus maximus muscle. And nerve supply is from the inferior gluteal nerve. Now this muscle is the only one inferior gluteal nerve supplies. In functional wise, the gluteus maximus muscle elicits its function in several ways. Actually, it elicits a combination of lateral rotation and extension of the hip joint. Now, if you think the insertion of this muscle, it inserts into the gluteal tuberosity as well as the iliotibial tract. Now, if we work out the muscle contraction, it functions as an extensor of the hip joint and also a lateral rotator. In extreme hip movements like running, climbing, this muscle is an important extensor of the hip joint. And also through the iliotibial tract, it supports the extended knee joint. When quiet walking, like where the hip in mid position, this muscle plays a negligible role. But in this position where the hip in midpoint, like quiet walking, the main extensor is the hamstrings. Again, the gluteus maximus muscle work as an anti-gravity muscle when standing with hip and knee slightly flexed, and also in sitting down from standing position. This is a powerful or chief anti-gravity muscle. Before going to discuss with the other structures in the gluteal region, we'll just look at what are the structures beneath the gluteus maximus muscle, or the muscles beneath the gluteus maximus muscle. Actually, the gluteus medius and the minimus also partially from the inferior aspect covered by this muscle. And we lift the gluteus maximus muscle, we can identify gluteus medius and beneath that gluteus minimus. And from the greater sciatic foramen, the piriformis muscle emerges. And beneath that, we can identify this is the superior gemellus muscle, and then obturator internus. Beneath the obturatus, we have the inferior gemellus, and beneath the inferior gemellus, you can see this quadratus femoris muscle. And again, from the ischial tuberosity, 4 hamstrings muscles origin happens. Gluteus medius muscle origin between the anterior and posterior gluteal line, and it inserts into the lateral surface of the greater trochanter. So its posterior third covered by the gluteus maximus and the anterior part covered by the deep fascia. Gluteus medius and minimus are supplied by the superior gluteal nerve. Gluteus medius and minimus together are the abductors of the hip joint. I'll explain this later in this video. Gluteus minimus muscle origin between the anterior or the middle and inferior gluteal line. This is actually under the cover of the gluteus medius. It inserts into the anterior surface of the greater trochanter. A nerve supplied by the superior gluteal nerve. So I mentioned this gluteus medius and minimus, both are powerful abductors of the thigh, and their anterior fibers also act as medial rotators. These two muscles actually very important to maintain the balance of the body when walking or running. What happens is when walking or running, the side where the leg off the ground, the pelvis of that side due to the gravities tend to tilt downwards. But the contraction of other side, gluteus medius and minimus, prevent this tilting. What happens when these muscles are not functioning properly, or the thigh abductors, the pelvis of the unaffected side going to tilt downwards. This is the Trendelenburg sign. I will explain in detail what is the Trendelenburg sign and its anatomical basis in a separate video. The first muscle in deeper layer we are going to discuss is the piriformis muscle. Actually, this is the key muscle of this gluteal region. We take this muscle as a demarcation to divide the vessels and nerves into superior gluteal and the inferior gluteal. Structures above the piriformis muscle we call the superior gluteal. Structures below the piriformis we call inferior gluteal. Now this muscle originates from the front of the middle three sacral pieces and some fibers from the upper margin of the sciatic notch, greater sciatic notch. It passes laterally behind the sacral plexus and emerges through the greater sciatic foramen and inserts to the medial surface of the greater trochanter. This muscle is supplied by the anterior rami of S1 and S2 sacral nerves. These whole muscles inserts into the medial surface of the greater trochanter. So if you imagine when all these muscles contract, actually rotate the femur laterally when the thigh is extended. When the thigh is flexed, this muscle acts as the abductors also and act together to adjust and stabilize the hip. Obturator internus muscle. So this is the muscle and it originates from the obturator membrane of the pelvic surface and the surrounding bone of the obturator foramen. Then the muscle fibers converge posteriorly to lesser sciatic foramen and turn sharply over the lesser sciatic notch. Then again, as I mentioned, these inserts into the medial surface of the greater trochanter. These three muscles, superior gemellus, obturator internus, inferior gemellus, inserts into the upper medial surface of the greater trochanter as a combined tendon. The levator muscle arises from the fascia covering of the pelvic surface of the obturator internus. This muscle has its own nerve, which is nerve to obturator internus. Superior gemellus origin from the ischial spine and inferior gemellus origin from the ischial tuberosity. Both these muscles, as I mentioned, combine with the obturator internus and inserts into the medial aspects of the greater trochanter as a combined tendon. Superior gemellus is supplied by the nerve to obturator internus and the inferior gemellus is supplied by the nerve to quadratus femoris. Quadratus femoris muscle is a rectangular muscle. It lies edge to edge with the inferior gemellus above and the adductor magnus below. It originates from the medial margin of the ischial tuberosity and inserts into the quadrate tubercle somewhere there of the femur. You can see this muscle is covering the neck of the femur. Actually, the tendon of the obturator externus separates the neck of femur from this muscle. Quadratus femoris is supplied by the nerve to quadratus femoris. So we'll see what are the structures emerge from the pelvis through this greater and lesser sciatic foramen into the gluteal region. You know the greater sciatic foramen is formed by the greater sciatic notch and the ischial and the sacrospinous ligament and the sacrotuberous ligament, and the lesser sciatic foramen also formed by these structures. There are several vessels, nerves come out from the pelvis into the gluteal region and some come out and go again into the pelvis from the gluteal region. So there are a number of structures. In cadavers, actually sometimes it might be difficult to identify the structures in the gluteal region at a glance. So if you can locate the piriformis muscle, you can easily demarcate the superior gluteal and inferior gluteal vessels and structures. Above the piriformis muscle, so this is the piriformis muscle. Above that, superior gluteal nerve and superior gluteal artery and also superior gluteal veins emerges. Now the superior gluteal veins are venae comitantes and the superior gluteal artery is a branch from internal iliac artery. Below the piriformis we can see inferior gluteal nerve again from the sacral plexus and inferior gluteal artery arise from the internal iliac artery. Inferior gluteal veins again these are venae comitantes of the inferior gluteal artery emerges below the piriformis muscle. Pudendal nerve also emerging below the piriformis muscle along with the pudendal vessels. And nerve to obturator internus, nerve to quadratus femoris, sciatic nerve, posterior cutaneous nerve also emerged beneath the piriformis muscle. Gluteal region is a common site for administer intramuscular injections. By selecting the upper outer quadrant, the needle reached the gluteus medius and minimus without damaging the sciatic nerve. Thank you for joining the Anatomy Everywhere YouTube channel. Stay tuned with us to receive more anatomy video lessons.